A 25-year female patient sustained severe burn injury. How will you manage? What measures you will take at the site of accident? When seen at the scene of accident, remove her from source of heat to avoid further injury. Maintain airway as victim may sustain respiratory tract burn due to inhalation of smoke or flame. Maintenance of airway and breathing is essential before sending the patient to hospital. Start an intravenous line and start Ringer's lactate fluid infusion before sending her to hospital. If flame burn, there is a role of cold water lavage, irrigating with copious amount of cold water, or cold water sponging help in minimizing the depth of tissue damage due to the excessive temperature. Transport quickly to hospital on arrival at ER. Like trauma management, primary survey and resuscitation is the first step by ABCDEF. A. Maintenance of airway. B. Maintenance of breathing. C. Maintenance of circulation. D. Assessment of disability. E. Exposure in a controlled environment. F. Lewd resuscitation, secondary survey, a detailed history, and a head-to-foot examination detail history about the mechanism of burn injury, flame burn or scald, duration of contact, time of accident, pain, respiratory distress, any other injury, any associated medical illness. Examination. Assess the surface area of burn by following the rule of 9. Assess the depth of burn, superficial or deep burns. Features of other injury as patient might fall after sustaining burn. So, a thorough head-to-foot examination is essential.